Why does it matter so much how an injection is administered? Isn't it all about the medicine? Well, the answer is a resounding no. In fact, the process of administering an injection is as crucial as the medicine itself. It's a delicate dance of precision, safety, and technique, one that demands our utmost attention and diligence. Let's start by understanding the basic procedure of administering an injection. There are four main types of injections: intramuscular, subcutaneous, intradermal, and intravenous. Each type requires a different method and depth of injection. First, it's vital to prepare the equipment. This includes a clean workspace, the correct needle and syringe, the medication and protective equipment like gloves. Next, the healthcare professional must identify the correct injection site. This varies depending on the type of injection and the patient's age, body mass, and medical condition. Once the site has been identified, it must be cleaned with an alcohol swab in a circular motion, starting at the center and moving outwards to prevent contamination. Then it's time to administer the injection. The needle should be held at the correct angle, 90 degrees for intramuscular and intravenous injections and 45 degrees for subcutaneous injections. The needle is then inserted quickly and smoothly to minimize patient discomfort. After the needle is inserted, the plunger is pulled back slightly to check for blood. If blood appears in the syringe, the needle has hit a blood vessel and needs to be repositioned. If no blood appears, the medication can be injected slowly and steadily, ensuring the patient's comfort. The needle is then withdrawn at the same angle it was inserted, and the site is gently pressed with a cotton ball or gauze to stop any bleeding. Lastly, dispose of the used needle and syringe in a sharp container and document the procedure. To recap, the correct injection procedure is a meticulous process that requires attention to detail, precision, and safety measures. It constitutes preparing the equipment, identifying and cleaning the injection site, administering the injection at the correct angle, checking for blood, injecting the medication, withdrawing the needle, and disposing of the used equipment. Remember, each step is equally important in ensuring the effectiveness of the medication, minimizing patient discomfort, and preventing potential complications. So, whether you're a seasoned healthcare professional or a student in training, it's essential to always follow the correct injection procedure. Because in healthcare, every detail matters.